Even with all our technology and testing, some disorders are still a mystery, like functional neurologic disorder, or FND. This condition means the brain can't properly communicate with the rest of the body, but there's nothing physically wrong, at least that doctors can tell.
So there's nothing structurally wrong with the brain or the spinal cord or the peripheral nerves, but it's rather the functioning of the signaling between the brain and the rest of the nervous system that has become dysfunctional. So when people are diagnosed with functional neurologic disorder, they usually have a number of tests that have already been done, neurologic workup that has been negative, revealing, there's nothing structurally wrong with the nervous system.
That's Dr. Danielle Larson, a movement disorder specialist at Northwestern Medicine. She says the symptoms of FND can look very different depending on the person.
It can manifest as a tremor, like affecting any part of the body. It can be trouble with walking, balance problems, weakness. People can have sensory symptoms or pain manifestations. And people can also have speech-related changes, the most common being stuttering speech.
But if there's no damage to the brain, what's causing these symptoms? Well, that's still unknown. There hasn't been much research into functional neurologic disorders, but Larson says that's starting to change.
A lot more research is going into since we have a better understanding of the condition and it's being recognized and diagnosed much more readily than it had been in the past.
Some of this research includes functional MRI tests that are showing people with FND have different signaling patterns in the brain compared to those without the disorder. And while there's no concrete evidence yet, the current theory is that stressful events are a main trigger.
So functional neurologic disorders typically start abruptly. For example, people wake up one day with symptoms kind of out of the blue. It can also be common that people have a procedure done, maybe just a routine procedure. And then once that procedure is over, their symptoms start. So it's thought that potentially that procedure, even if it was a standard procedure, no complications, that was a stressor to the body and to the nervous system and kind of triggered these symptoms.
Larson says some people may be more likely to develop the condition if they already have anxiety, depression, or are under constant stress. However, this idea is based on observations and hasn't yet been proven through research. Still, the rise in cases during the COVID-19 pandemic does show a strong case for stress and anxiety being a trigger.
So there was an uptick in functional neurologic disorders of many different kinds during the COVID pandemic, not just from people getting COVID infection, but just being affected by social isolation and anxiety that the pandemic brought to people.
One type of FND, called functional tic-like behavior, unexpectedly skyrocketed during the pandemic. Many of us are familiar with the condition Tourette's syndrome, a class of chronic tic disorders where children develop multiple motor and vocal tics before age 18. However, while classic tics mainly affect boys, functional tics are being diagnosed primarily in females, and the average age of onset is much older, between 18 and 21 years old.
Another difference between them is the comorbidities that we see. So with classic Tourette's syndrome or tic disorders, people are quite likely to have comorbid ADHD or OCD. It's very common to go along with Tourette's syndrome. And there's usually a family history of tics in the family or ADD or OCD in the family. But people with functional tic-like behaviors are less likely to have ADD or OCD and are more likely to have anxiety and depression. And then what the actual tics look like is different between the two as well.
Classic motor tics often involve the face, neck, and shoulders, like blinking, head jerks, and shoulder shrugs. On the other hand, people with functional tic-like behaviors tend to have more movement in their limbs.
So arm movements and really kind of jerky, sudden arm movements, and also self-injurious behavior, which is really rare in Tourette's syndrome or classic tics, such as punching yourself or hitting yourself, but that is seen more commonly in the functional tic-like behaviors. And also coprolalia or, repetition of swear words is also seen more in functional tic-like behaviors. It's pretty uncommon in classic tics.
Dr. Nicole Zaka is a pediatric psychologist at Cincinnati Children's Hospital Medical Center. Many of her patients have functional tics, and she's seen firsthand the rise in tic-like behaviors during the pandemic. And while the condition isn't new, experts are interested in what seems to be causing the rise in cases: social media. One platform has gained a lot of attention for the phenomenon that's being referred to as TikTok tics. Even though social media has been a prominent fixture in society for years, Zaka says the pandemic provided a perfect storm for these platforms to become potential triggers for this condition.
And sort of what we think happened is that there was kind of a coming together of people that were maybe already at risk for developing functional symptoms. And the COVID pandemic presented a couple unique situations that really kind of activated that symptom presentation from the standpoint of obviously the stressors that are associated with the COVID pandemic, where teens were very quickly sort of cut off from their normal social support systems and were doing online school, lots of changes in their just their routines, right? Changes in sleep, changes in eating, changes in activity level.
Along with the physical changes of staying inside and reduced activity levels, Zaka believes the psychosocial stressors, like feeling disconnected from your friends, also played a part.
And so then what we think happened is that folks reached out to kind of find that connection through TikTok, that the TikTok algorithm, right, it created these categories of the sort of TikTok tics, and there was some kind of modeling effect for these functional tics. And, the functional tics that folks are presenting with are very real. They are not voluntary. They are not fake. They are not done on purpose. And there's a component of the development of functional tics that we don't yet understand from the standpoint of this modeling.
In psychology, modeling refers to behavior that's learned through observation and imitation, either consciously or unconsciously. The current idea behind TikTok tics is that people spend so much time watching videos of creators with tics, their mind learns to imitate those actions. These increased rates of tic-like behaviors have been reported in the US, UK, Australia, and Europe. While it's a similar condition to classic tic disorders, there are some distinct differences. Larson says that classic tics are semi-voluntary, purposeless, and people have the urge to perform the tic. What's also interesting is that people with this diagnosis can suppress the action for a short time, giving them at least a little control over the movement. Functional tic-like behaviors are a bit different.
People typically don't say that they feel that movement coming, they feel an urge to do it, or they feel a sense of relief afterwards. Most people just say that it's random, it comes out of nowhere, they can't control it. So it's missing the basic criteria of how we define a tic as a movement disorder.
And though we have these distinctions, there's not much information about functional tic-like disorder that's set in stone.
We don't have a lot of control over the information that is out there on Google. And so some of it is fantastic and it is research supported, and all of the information that that patients should have access to be able to increase their understanding of any diagnoses that they might have and any treatments that are out there. And then there's all the information that's out there on the internet and on social media that isn't necessarily research supported and isn't necessarily helpful for patients in terms of connecting to the right treatment and really kind of getting better.
Despite this, Zaka says patients can get better and recover from a functional tic-like disorder with proper treatment. Zaka says a big part of treatment is educating the patient about their condition while also teaching management and coping skills.
The key part of treatment for functional symptoms is psychoeducation. So it's education about why the symptoms are happening in the first place, and then what patients can actually do about it. And so in addition to the psychoeducation, typically we take a cognitive behavioral therapy approach. Components of cognitive behavioral therapy have, in my clinical experience so far, been most effective. We need more research on what exactly the key parts of the treatment are that are going to be most effective.
In Zaka's clinical experience, she noticed that teaching her patients about psychosocial stressors and how to manage them is a big part of their recovery. These stressors are physical, mental, social, and environmental, and can be anything from feeling tired, being hungry, or even feeling overstimulated.
And the brain has to respond to these stressors by activating the autonomic nervous system. And so then what can happen sometimes is that when the brain isn't able to kind of deactivate, when the body is not able to come back to rest, either because there are too many small stressors coming at a person at once, or, one big stressor, then, we start to see these functional symptoms, functional tics,
In addition to teaching patients about why they're having these tics, the next step is to figure out how to stop them.
So what are the actual skills a patient can learn to re-regulate their nervous system, to slow things back down again, and to kind of manage the different things that pop up, right? So treatment is focused on increasing function. We start with how, let's look at sleep, let's look at eating, let's look at kind of the pace of the schedule. How are we using our behavioral activation skills, or just getting up and doing something, having something to do when the tics are happening or even before they happen.
Which can involve distraction techniques to take your attention away from the movements that are out of your control. Zaka also utilizes relaxation strategies and has her patients focus on doing more activities that they genuinely enjoy.
And then the next kind of step of treatment is, what are the thinking strategies that people can use? So oftentimes, as you can imagine, if you're having really complex impairing tics in the middle of a school day, at some point you're going to start thinking about how much these tics are going to impair you. And you're going to start thinking about, well, what are people going to say? And so part of the treatment, in addition to that education, in addition to learning what you can do either to prevent the tics or when you're having the tics, is also learning how to manage the thoughts that are popping up about the tics or about other situations.
Even with the dramatic rise in functional tic cases during the pandemic, Zaka says that people are getting treatment and recovering. And though stressors like anxiety and depression are thought to be big contributors to developing this condition, Zaka wants people to know that that doesn't make the condition any less real.
Symptoms are very real. They are not voluntary. They are not just due to anxiety, but anxiety certainly makes them worse, but does not cause them in the first place. Getting patients connected to therapists and to psychologists and clinics that are providing good psychoeducation and cognitive behavioral therapy is really what we want for patients.
You can find more information about Drs. Danielle Larson, Nicole Zaka, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield. Coming up next week on Radio Health Journal.
We are addressing the needs of people who can't get service from the larger healthcare system.
How safety net hospitals provide care without needing to rely on insurance companies or a fee-for-service system.
Then we see natural flavors in many food products, but what are they?
There may not be that much of a difference between the artificial and the natural flavor in terms of the chemical composition of what's being added to the product.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
My genetics showed a very high sort of association with violence, aggression, and low interpersonal empathy. And those two biological markers then set me on a quest.
Better understanding of what it means to be a psychopath. Then,
America's first subway was really built to get streetcars off the streets of downtown Boston.
We look at Boston this week, the birthplace of mass transit in America. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.